Before taking omega-3 acid ethyl esters, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth with food, as directed by your doctor, usually once or twice a day. It's important to swallow the capsules whole and not crush, chew, or dissolve them. Do not substitute other omega-3 fatty acids or fish oil products for this medication without consulting your doctor first, as they may not contain the same amount and type of fatty acids. The dosage of omega-3 acid ethyl esters is based on your medical condition and response to treatment. It's important to take this medication regularly to get the most benefit from it, and to help you remember, take it at the same times each day. Even if you feel well, it's important to keep taking this medication. It's also important to continue following your doctor's advice about diet and exercise while taking omega-3 acid ethyl esters. It may take up to 2 months to get the full benefits of this medication. If you experience upset stomach, burping, or a strange taste in your mouth, be sure to let your doctor or pharmacist know. These side effects are usually mild and may go away on their own. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as easy bleeding or bruising. While rare, a serious allergic reaction to this medication can occur. Seek medical help right away if you develop symptoms such as a rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to speak with your healthcare provider. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking omega-3 acid ethyl esters, it's important to let your doctor or pharmacist know if you have any allergies to fish, shellfish, soy products, or if you have any other allergies. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have a history of alcohol use, diabetes, liver disease, or underactive thyroid, hypothyroidism. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, omega-3 acid ethyl esters should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, it's important to consult your doctor before using this medication. When taking omega-3 acid ethyl esters, it's important to be aware of potential drug interactions. Certain medications, including beta blockers, estrogens, and certain diuretics, as well as other vitamins and supplements like fish oil, may interact with omega-3 acid ethyl esters and affect how it works in your body. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. And as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone takes too much omega-3 acid ethyl esters and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. It's important not to share this medication with others. Your doctor may also want to monitor your liver function and lipid levels while you are taking this medication, so make sure to keep all your medical and lab appointments. For best results, it's recommended to use this medication along with a doctor-approved diet, exercise, and weight control. If you have any concerns about lowering your risk of heart disease, consult your doctor for more information. Remember, it's always best to follow your doctor's advice when it comes to your health. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and take the next dose at the regular time. Do not take double the dose to make up for the missed one. When it comes to storing omega-3 acid ethyl esters, it's best to keep it at room temperature, away from light and moisture. Avoid freezing it and do not store it in the bathroom. And remember to always keep medications out of the reach of children and pets. And when you no longer need the product or it has expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. Never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.